Hello everyone! For this video, I'm going to discuss the different career pathways for physical therapy graduates. Okay, so as you can see in this first slide, so as physical therapy graduates, you can generally have two opportunities, no? So first is a path for further education by taking up a postgraduate course or postgraduate degree. Or if, of course, you already have your license, you can eventually join the workforce. Okay? So, for those who are planning to take up on postgraduate degree, so here are the some possible options. So, you can, of course, take up medicine. You can either get master's degree on your desired course or topic, specialization. You can also study for a diploma or get a DPT or what we call the doctorate for physical therapy, which is available in the States, or do some continuing education by getting certification. So these are just some of examples for postgraduate course and degree. Now, if you are, for those who are wanting to get a job after graduation and after getting your license, then of course you can join the workforce, be part of it. And the options, some would continue to stay in the country, so work local, or travel to another country and work abroad. Okay? So, just a general overview for those who would like to take a postgraduate degree. So, again, those sometimes, or actually it's common based on my experience from my former students, no? So, that they would take physical therapy as a pre-med course. So, of course, because they want to pursue being a doctor. So, if some of you may ask, what are the advantages of taking up physical therapy as your pre-med course? So, as mentioned, anatomy and physiology are the bread and butter of the PT profession. Thus, it would be, of course, an advantage, especially for the first year, okay? Based on the stories of my former students, especially on the first year of med school, because they are anatomy and physiology heavy on those years, okay? Now, of course, PT students are also exposed to the different medical and surgical conditions of the different systems of the body. So, it will be helpful since you can be familiar with the diseases and its clinical manifestations, epidemiology, the disorders, the signs and symptoms. So, that would be also an advantage for you, okay? And then, of course, another advantage of taking up physical therapy as your pre-med course is because we are very heavy and focused on patient and client management and clinical reasoning and decision-making skills, right? So, because PT students have the skills to conduct examination, meaning history taking, physical examination, okay? And then we also have formulation of diagnosis, so identifying the signs and symptoms and the problems of a patient. And of course, creating a plan of care or providing intervention. So those are the things that you can use, no? Or you can maximize if you plan to go to med school. And of course, behind this client management, clinical reasoning, and decision-making skills, the students also develop the ability to communicate and develop rapport with the patients, which is, of course, very important if you want to be, no, you want to be a doctor. All right? So, now, for some, they would like to take a master's degree and eventually take a doctoral degree, no? So, getting a master's degree can help us physical therapists be more involved in research work, which could also be an advantage in developing networks and connections through academic work, research, poster presentations, and conferences. So I'm not saying this is the only way to develop networks and connections, but getting master's degree and a doctorate degree can widen your horizons when it comes to the profession and the community that we are in. All right? And then, of course, every PTs have the opportunity to take a diploma course or the DPT or the Doctor of Physical Therapy program, which is available in the States or in US, and other certifications depending on what field you want to develop, no? And this is also a good way or a good pathway because it will help you develop an area of specialty, or it will help you provide a specialization that can, of course, add value to your undergraduate degree. Okay? So, now, if your choice is to join the workforce, there's a chance for you to get a job in any of the following healthcare systems. So, you can work in hospitals, acute care facilities, private practice, outpatient clinics, nursing homes, home health, schools, sports and fitness facilities, corporate offices. This was a good one because you also have to check on the ergonomics, no, of the workers or the office workers. Military, yes, you have that option to be a health officer. And then, of course, you can apply for public health and other systems. All right? So, in joining the workforce, you can do part-time or full-time work commitments, gain practical experience and opportunities, and of course, develop your skill set on your desired field. Alright? So, these are also good advantages if you want to work. No? If you want to work on the different healthcare system. Now, in the Philippines, here are the common career pathways for physical therapy graduates. Alright? So, some of the students would, of course, or not students, some of the graduates would, of course, join the workforce. And the common setting here in the Philippines is through the hospitals, outpatient clinics, home health, and sports and fitness facilities. Alright? Meanwhile, also, there are a lot of students who would pursue a career in medicine. So that is also common here in the Philippines. And lastly, after gaining some experience here in our country, a lot of physical therapy graduates would opt to take exam and get license to work abroad. And the common regions are in US, in Middle East, Australia, and Canada. Okay? So, this pie chart is according to the American Physical Therapy Association. So, this is where the physical therapists practice abroad. So, majority of PTs work in private outpatient office or group practice. And then second is hospital-based outpatient facility, and then acute care hospital setting. But then, of course, a lot of people or a lot of physical therapists also conduct research, work on skilled nursing facility, and conduct home care. Okay? So, just to give you some reasons, no, if you're planning to choose the physical therapy as a career, according to the US News and World Report, physical therapy is one of the top-ranked healthcare profession that provides job satisfaction, it fosters relationship with patients, allows you to see direct impact and benefit of your work. And it is because, as you learn the work or the practice of physical therapist, you can really see that you are part of the journey of your patient. And just an example, you can see your patient from being bedbound to being able to stand and walk. So definitely these three, you can get that fulfillment and relationship with your patient, and it can directly impact your work. Okay? Now, flexibility, because as physical therapist, you can be a clinician, you can be a researcher, you can be an educator, an entrepreneur, all at the same time. And if I may share, no, one also of the good things that I like about being a physical therapist is when it comes to the the schedule of work, no? It depends on what field or what specialization, of course, you would like to focus on. But most of the physical therapy jobs in the workforce are only applied during office hours, no? Meaning, you are either working from 7 a.m. to 4 p.m., 8 a.m. to 5 p.m., or 9 a.m. to 6 p.m. So that's the usual schedule. So we don't have night shift. So meaning you can, of course, maximize your time and do other stuff that would, of course, help you develop professionally. Okay? And lastly, and one of the most important reasons, of course, of choosing the physical therapy as a career is because movement is essential to life. And as physical therapists, mobility is our specialty. Okay? So, that's it for the career pathways for